recognizes Mr. Luetkemeyer for 5 minutes.
Thank you, Mr. Chairman. And just to follow up on last week's hearing, in that hearing, I had a long discussion with Dr. Redfield with regards to the incorrect coding of individuals' deaths, so that there was an overstatement of deaths due to corona, which was a follow-up to a previous question I asked of Admiral Gurwar in a previous hearing. And and we found out 2 more states now are actually looking into this as well. And we have sent a letter, and I think I sent a copy of it to you, requesting information from both Dr. Redfield and the Admiral with regards to what they're going to be doing about it. So just to give you a heads up. Mr. Lips, just want to talk to you just a second with regards to something that Dr. Redfield said last week. He said, I want to reemphasize because I don't think I can emphasize it enough. As the director of the Center for Disease Control, the leading public health agency in the world, it is in the public health interest to these K through 12 students to get those students back open to face-to-face learning. We have to be honest that the public health interest of students in this nation right now is to get a quality education in face-to-face learning. From your previous statements, I assume you agree with that statement, Mr. Lips.
I do. I think that should certainly be the goal. We should be doing everything we can to get children back into school in a safe manner. And we should be giving flexibility to parents and teachers and school personnel to make decisions about risk, to create the best circumstance for our local communities. But certainly the goal should be trying to get kids back in school. These prolonged school closures are devastating for children, particularly for low-income children who we know are falling further and further behind every day that schools remain closed. So we've seen public health guidance from the American Academy of Pediatrics, the CDC, of best practices that can be used to reopen schools. Wherever possible, schools should think creatively about following those guidelines to bring kids back into the classroom.
Well, I know that there's a paper put out by the CDC that is very extensive, 8 pages here. It deals with everything from comparing the COVID to the flu, harmful learning aspects that if we don't go back to school with regards to losing past education, how they fall backwards, and then the digital way, the virtual way of learning, where it can get you by. It's not a very good, efficient way of doing it. The social, emotional skill development that is not there. Safety, which I think you've mentioned. We're one of the few people that mentioned safety today. Nutrition, physical activity. These are all important things I think that we need to consider when you start taking a look at. And this is why the professionals have all said that we need to go back to school. With that in mind, Secretary Duncan, in May of 2009, during the spring H1N1 outbreak, the outbreak that killed 358 children between April and October of that year, you said to the school superintendents and principals, I quote, I urge you to take your cues from the public health officials in your area, in your state, and at the Centers for Disease Control and Prevention. But this time around, it seems different. Last Friday in this committee, CDC Director Redfield testified and confirmed the urgent need to get students back to school. As I've indicated with this report, it's very extensive. It deals with all of the myriad of issues there. But however, the following day you tweeted, why are we asking 15,000 school districts and 100,000 schools to figure this out by themselves? So my question is, why is it acceptable for superintendents to rely on public health officials when you were secretary, but not now?
No, they need to absolutely rely on that. And what the challenge has been at the federal level, there hasn't been a plan. There hasn't been investment. We haven't done what we needed to do for the previous 4 or 5 months to make this possible. And now we have 1,000 people dying per day across the country. Let me
stop right there and let me put some more facts on the table here. This is a brand new disease we knew nothing about as of January 1. It's a clean slate. We never heard about the coronavirus. Now, over the last several months, we continue to develop plans and strategies as new evidence comes out, as new information comes out. And I think last week we saw in our committee, Ranking Member Scalise had a stack of papers about 18 inches tall that were different plans that were in place to try and address many of this thing. So I think that argument rings pretty hollow whenever you look at the bulk of evidence that's there to show that there are plans that we're trying to be flexible, contain, and continue to improve and address issues as they pop up. And this is an ongoing thing. We have to manage this virus, and this is why I think, as we go through and we have schools open up. In my area, it's not unusual to have a school closed down for a day or two or three with the flu that runs through the community. I would anticipate that same thing happening here. As the COVID runs through the community, go down for a period of a week or so and come back up. I think we can manage this thing, and we just have to learn how to do that. So with that, I yield back to the chairman.